And one of the band-aid approaches that so many people are using now, especially with the legalization of marijuana, is using marijuana for calming their anxiety. I mean, short term it might work, but long term it actually makes anxiety worse. But what's really shocking is the impact it has on the male sex hormones, making them estrogen dominant. Can you talk a little bit about that and the side effect?
Yeah. So with the legalization of marijuana, a lot of people have been relying on it, like you mentioned, to treat those mental health disorders. But yes, it can decrease testosterone levels and increase estrogen. So in our bodies, estrogen and testosterone can convert back and forth to each other. So if I have a man who say I've put him on testosterone replacement, I am giving him something to block the conversion of that testosterone to estrogen. So basically, when you have someone who's on marijuana, you're enabling that conversion of testosterone to estrogen, which makes them more estrogen dominant. In a man, they might notice if they have more estrogen that they're more emotional. And it oftentimes is weepy, but it can be just, again, more emotional. They get upset rather easily. And instead of more of an anger picture, it might be more of like a sad weepiness. They also might experience things like nipple tenderness if estrogen gets too high in a man. So yeah, it's such a double-edged sword because instead of people addressing the root cause, they are using it as a Band-Aid. And I think there's not enough conversation in that space about, a lot of times we only ever want to focus on the good. As a practitioner or the FDA or whoever, it's all, what are all of the benefits? And we tend to say, okay, well, let's focus here and let's not talk about any of the negatives. And when people have negative reactions because of the way that the medical model is built, which is you are an arm, so I look at the arm. You are a stomach, so I look at the stomach. You are a gland, so I look at the glands, but I don't look at anything else. And none of your providers talk. You tend to get this approach where things can easily be mixed. Whereas if someone was taking that full body approach, they could say, oh, well, you started this, your symptoms started here, so we just need to get you off of that and maybe support that testosterone pathway instead, which can be a much easier fix than now you're on 6 medications later, and we could have taken care of it with, one medication and maybe a few herbs and some diet and lifestyle changes.
And the scary part is with the marijuana use with men, doesn't it also create softening of the features?
Well, because of the increasing estrogen.
Right.
So yes, you will get a feminized man, right? We want oftentimes men that have testosterone that's, they want to be male and that is the role that they are playing. You want more masculine features. You want more, again, that masculine energy, even just with having more estrogen in a man. You're getting things like nipple tenderness, more weepy. It's directly affecting kind of every aspect.
Yeah, and I think the only doctor that I've actually heard talk about estrogen dominance in men is Dr. John Gray. And he's the one that wrote Men Are From Mars, Women Are From Venus. And so I don't know why he's the only one I've ever heard talk about that. And a lot of men are not aware that they have even estrogen or the fact that it can be dominant and that can feminize them.
Yes. And all of my, like I mentioned, all the patients that I've put on testosterone replacement are on an herb to block or medication, depending on how not everyone converts the same, right? So when we take a blanket approach to any treatment process, it's flawed because we're all individuals. I have some patients who deal really well with the herbs and that can block that conversion, but I have some that regardless of how much of the herb I have them on, they are just sprinting testosterone and estrogen. So in those cases, I need to then put them on a medication. But you also talk about the sperm changes, right? So in a situation where you're converting, sperm have to be, I think we don't think of this process being so specific, but sperm have to be the right shape, size, the tail has to be right, the head has to be shaped a certain way in order to reproduce. The tail has to work, right? It has to be able to swim fast enough. If we have feminized that process by having a man who is more estrogen dominant, you are not able to have that. So they'll do the sperm analysis and you'll see in the morphology that they are misshapen. Their tail might be too short or too long, or the head is too round and not pointy enough. And so then you have an issue with male fertility, which when we talk about fertility, most of the conversation relies on the woman, right? She's too old, or what did you do? Do you have endometriosis or fibroids or whatever? But we should be analyzing both male and female patients when they come in and they want help with things like fertility, because it can very much be a male caused fertility due to that feminization of the sex hormones.